Well, a Minnesota mother of 3 is in need of a life-saving surgery.
I need for my kids.
Doctors told Socorro Neri Vergara that she had less than a year to live. That was 2 years ago. And every day since, she wonders if she'll see another day. She goes to kidney dialysis weekly, but she needs a kidney transplant so her other organs don't shut down. Socorro is an undocumented immigrant. As WCCO's Jennifer Mayerle reports, facing healthcare challenges is an obstacle Socorro didn't think about when she left Mexico in search of a better life.
This is my family.
Socorro Neri Vergara has built a life in St. Paul. She married Francisco Bautista in 2000, 2 years after she left Mexico to join him in the United States.
We are a very great family.
The couple has 3 kids. Michelle is the oldest.
My mom is a great mom. She helps us with everything we need.
The family fears she may not be with them much longer. 2 years ago, Socorro was diagnosed with kidney failure.
She don't have any kidney transplant, but she's going to die.
She has been on dialysis, but that's where her medical coverage ends.
Please help me for. I need for my kids.
Socorro is an undocumented immigrant, and because of her status, she qualifies only for emergency medical assistance. The insurance is for non-citizen applicants and covers emergencies, kidney dialysis, but not a transplant.
The doctor, he told us he can help us because we are illegal.
It's a harsh reality for a family with 3 kids born legally in the United States, a reality the adults didn't consider when they left Mexico in search of a better life.
Because she wasn't born here, and she came illegally, so that's the reason why she can't get it. I think it's not fair just because she's an immigrant.
We need a miracle. That's what we need.
Socorro has 3 siblings living in Minnesota, all willing to donate a kidney if they're a match. That is not enough. A small percentage of non-U.S. citizens will be put on the organ transplant list each year. It's up to the individual transplant center to decide who will be listed. Socorro was told her insurance does not cover evaluation for either a live or deceased donor kidney transplant. And in future, if you have medical assistance coverage, we would be able to assist you. That won't happen given her immigration status.
Basically, we don't have any options. If we can't move forward. We are stuck right in the middle. We can't move forward. We can go back.
Her kids can't bear the thought of losing their mom.
I don't want her to leave just yet. I still need her. Me and my brother still need her.
All right, here's how the numbers break down according to United Network for Organ Sharing. At the end of last month, of the just over 101,000 people on the waiting list for a kidney transplant, 1,262 may be in a situation similar to Socorro. That's roughly 1% of the waiting list.
And so, Jennifer, it sounds like very few non-residents get on the kidney transplant waiting list.
That's right, Amelia. And of all the kidney transplants done last year, only 1% were non-residents. And keep in mind, people in Socorro's category are not all undocumented. I'm told there are people here on visas, travelers, expats. Likely a very small percentage are people who are undocumented. When making a determination about who should receive a kidney transplant, centers, or just transplants in general, centers look at the viability of the candidate to receive a transplant and the ability to pay for future medical care, among other criteria, Amelia.
All right. Thank you, Jennifer.